accountability, more accounting, so that a district health board can put its hand up and say 100% of its contracted providers have emergency plans in place and they do work, and you do need to test them to make sure they work.
Yeah.
There's nothing worse than having a plan that sat on a shelf and then never worked.
Yeah, yeah, and that people know about it, you know, because when emergency hits, you know, you need people to action straight away, don't
That's
you?
right, yeah.
Because what are some of the problems that can happen if our community services aren't prepared?
If a service falls over and you or me require heart pills or urgent medication or what have you, you know, you're going to need to access files that might be sitting on a computer that's no longer working. So you need to know that your data is safe, it can be accessed if need be from another building, and that those plans have been put in place. Or if slips close off roads, or if you're out of town and you can't access services, those kinds of things need to be thought about.
Do you see the improvements starting to happen?
I think again, hit and miss, mixed
Yeah.
bag. Certain areas might be doing better than others, and no assumptions can really be made.
Yeah. On an individual level, within, you know, Waikato Bay of Plenty region, do you think we're pretty prepared, or?
It's hard to say.
Yeah.
I'd say still a lot of work to be done. I know there is some work being thought of at the moment, and definitely more so after Christchurch. But to me, now's the time to bring out the microscope and ensure that it does. Because if we don't take this opportunity, then when our disasters strike, we may be much worse off.
Yeah, definitely. Have you got any tips that we can do?
Yeah, that's one good thing. Is there is resource around, and there is plenty of advice. And so, really, firstly, everyone should personally have their own emergency plan. Like you should have your own 72-hour pack, so you know that you can fend for yourself for 72 hours until emergency services can help. And the kinds of planning that you do around your home, such as, okay, here's where we will all meet in this kind of situation. Transfer that into the services as well. Ask your own health services, have they got planning in place? There are resources online, yes. There's, I can give you a website address, but for any services, but even people can use these for their own purposes. Planning templates. So basically 1, 2, 3, put your name on it, fill in the blanks, and you've got an operative plan to start working with. And the picture that you're holding up is a little bit more advanced, but it's a way to organise. It's called the SIMS model, and it's Coordinated Incident Management System, so that all the services, they operate this way. So you know as soon as something needs to be pulled together quickly, for example from the boxes, there's a central controller, and someone does the operations, someone does the planning and logistics, and someone does the intelligence. And you know, everyone knows what they're doing, and it happens quickly. Online website, www.HEPNZ, stands for Health Emergency Plan New Zealand, .wikispaces.com. By clicking on there, you'll get a template to fill in the blank. Simple templates, hard templates, 50-page templates, from something you just give to your staff to something that lays out all the 4 R's of emergency reduction, emergency management.
Which is fantastic.
Which is reduce the risk and be ready, and then respond, and then recover.
Chris, why are you so passionate?
It's a good question. I come from a public health background. I've worked as a health department inspector, as a community advocate, in a lot of areas in health and social services. Why I'm standing for the health board election, to try and make a difference, because I see lots of gaps where, because there's not enough money to go around, the gaps just get left, and people are missing out. And it's you know, it's your family, my family, who will miss out in times of need. So I am passionate to make a difference, and if we can't get to all the gaps straight away, that doesn't mean we drop them. We actually form a plan. Well, how do we get to them? By working collaboratively.
So hopefully filling in those gaps a little bit, so that the Lakes
District Health Board.
Lakes District Health Board. All the best for that.
Thank you.
Hopefully we can get some people to vote for you. Yay! You're going to make a difference. Chris, thank you so much for joining me.
Pleasure.
Chris Webber there, taking a look at community health services in our communities. How well are we prepared if a disaster strikes? Don't forget, Chris is running for the Lakes Community Health Board. don't forget to vote for him. Right, and that's all that we've got time for today. Thank you so much for joining me. Remember, our website is tvcentral.co.nz, or you can flick us an email, news@tvcentral.co.nz. Have a fantastic evening. I'll see you again tomorrow.